And for more on this outbreak and its potential effect in the U.S. and beyond, I'm now joined by Dr. Peter Chin Hong in San Francisco. He's a professor of medicine and an infectious disease specialist at the University of California in San Francisco. Doctor, thanks so much for coming on with us.
My pleasure, Karina.
The CDC has confirmed the country's first severe case of bird flu in a human. The patient is in critical condition, said to be exposed to dead birds with avian flu. He had some underlying condition. How concerned should we be?
I think as the general public, you shouldn't be concerned too much yet in terms of no human-to-human transmission. The cases that are severe being relatively rare, one in Louisiana and one also in British Columbia. But again, the train has already left the station, so I think it's really important for people to be vigilant, but not panicked.
What are the symptoms to be on the lookout for if someone suspects that they could have been exposed? And is there a way to mitigate any of the risks of contracting it?
Yeah, so great questions. The symptoms are very similar to human flu, which is in more serious cases, you'd have headaches, muscle aches, fever, and then it will progress to shortness of breath and pneumonia and maybe other complications. But the disease has been relatively mild so far in dairy workers and poultry workers with mainly pink eye or conjunctivitis and sort of like upper respiratory or sore throat and milder symptoms. But again, those milder symptoms may progress depending on what mutant may emerge.
Now, dozens of Americans have been diagnosed with avian flu. They had direct contact, for the most part, with sickened poultry or cows. But is human-to-human infection a possibility? I know you said it's not likely, but is it a possibility?
Oh, yes, it's a real possibility. In fact, many people think it will happen at some point. We can't predict exactly when. And the reason is as follows. We've known about H5N1 for about 3 decades, but recently, the pace of mutations has been picking up because there have been more transmissions, mainly in wild birds. It's probably the greatest threat to wild birds in a generation, and spilling over into more than 50 mammals. Researchers in San Diego show that we're just one mutation away, and as the patient in Louisiana and British Columbia exhibit, we can get seriously ill from this as well.
Yeah. So in your medical opinion, given all of that information you just gave us, do you think enough is being done by government agencies to control the spread of H5N1? Because the government has said they have no plans to pursue a vaccine at this point. What's your opinion on that?
I think enough isn't being done yet. There are some baby steps towards that. I think the state of emergency in California is a good start at a state level, but a state can only do so much. We need to incentivize more drugs, incentivize more vaccines, change that diagnostic test to something that's more rapid and more easily available for your average person, like in COVID. But again, we're not starting off in the beginning like COVID. Many of these threads are already in development. We have drugs, vaccines, and tests, but they're not widespread and they're not necessarily tailor-made as yet.
Mm-hmm. And Doctor, could cracks in the federal government's handling of the outbreak allow other risky new pathogens to somehow take root? Could we possibly see another pandemic in the next several years?
I hope not. But again, when we think about bird flu and our discussion bird flu, it is really not only about bird flu. It's a metaphor for other emerging infectious diseases. Whereas, it could be that illness in Congo or something new. And it requires more than just, a state or a public health emergency in a local jurisdiction. It requires a coordinated effort at the federal level, which is much more structural than we can do by ourselves.
Mm-hmm. Doctor, given everything we've been through concerning the coronavirus pandemic, how much better prepared are we to deal with the next pandemic whenever it happens?
I think we're prepared in some ways. Molecular medicine has advanced, so we can, with an mRNA vaccine, kind of cut and paste the code in a matter of weeks or at least a few months. But I think technology isn't really the issue here. It's really the implementation and dissemination of the technology so that all populations have access to it. And for that, and for national strategy, and for communicating clearly and with empathy, I think we still have a lot of work to do.
There are going to be a lot of people who are concerned, should we be eating eggs? Should we be eating chicken? Should we be eating beef? Can you help allay some of those concerns?
Oh, yes, definitely. I think the easiest one to talk about is raw milk and raw milk products. If you asked me this question 2 months ago, it would have been much less risky than right now because more and more cows are getting infected. Some people call it the COVID of cows. So that means that raw milk is becoming more and more risky in terms of your average lot. In fact, there were 2 cats in Los Angeles that reported in the last few days who died from drinking raw milk that their owners gave them inadvertently. So I think that's one thing. In terms of pasteurized milk products, no problem at all. The meat is safe, but again, raw meat fed to animals is probably going to be increasingly risky.
All right, all excellent advice and insight. We will leave it there. Dr. Peter Chin Hong, thank you for your time.
Thanks so much.